This is a story of Dr. Donald Onuha, a GP trainee who's one of the most hardworking GP trainees that I've worked with. What happened to his case was that he's done everything he could to the best of his ability. His peers like him and respected him. His patients love him. And his trainer thought that he was going to pass his exam. But every time he missed it by a few marks. And he was completely lost because he did everything he was supposed to do, but there was something that wasn't working. And he didn't know what to do. And this was quite a torturous journey for him. And he even confessed that he cried. It was grueling. It affected him, his family, his children. And then over 2 years, stuck in training, this SCA was a nightmare. Even his son mentioned to him like every time there's something wrong with the exam, and he couldn't spend time with his son. But Donald got an exceptional attempt. So after sitting the exam for 4 sittings, he was given one exceptional attempt. And that was going to make or break his career. If he passed his exam, he would CCT and become a GP. But if he didn't pass, then he could say goodbye to a GP career. So Donald realized that there was a big gap between where he was and where he needed to get to. To pass his exam and CCT, he had to close that gap. And if he kept doing the same things that he was doing, he knew that this wasn't going to work. So he did things differently and he used a proven system, proven strategies, and eventually he closed a gap, finished his training, and then became a GP. So the reason I'm sharing this story with you today is because I want you to see that there is hope. You can pass this exam if you use a right approach. Looking back now, Donald can smile and he can enjoy his life again and he can do his hobbies that he didn't have much time doing before. And he sent me a video of him playing the flute recently. So, if you're new here, my name is Dr. Erwin Kwun. I'm a GP medical educator, and I'm currently writing a book on the SCA preparation. So that's going to be published later this year. So I'm looking forward to teach you the best insights about the SCA today. I passed my RC exam during the pandemic first attempt, and I qualified in 2021. Since then, I've been helping over 350 GP trainees unlock their career and CCT. So we've got quite a lot to cover. And also, who here has actually watched any of my podcasts on YouTube? So I also run a YouTube channel where I interview guests on the consultation. And if you haven't seen this one, it's quite insightful. You will hear from Roger Neighbor himself about the essay preparation and how is it marked. So let's go with the next slide. So this is going to be an interactive session, and I'm hoping that you're going to get a lot from it. It's going to be fun. There'll be some quiz, and I will give you a free gift as well if you stay up until the end. And I'm going to give you a special offer for those who want to work with me one-to-one. I actually coach some trainees, and there's a select few number of trainees I can coach. And also there will be an opportunity for you to ask any questions about the SC exam, your preparation, anything you're not sure about. So the aim of this teaching today is to show you the common pitfalls, what set the top scorers apart from the rest, and how you can revise smarter but not harder, and how you can use AI as well to level up your preparation. So quick question for you. What do you think was a pass rate for the SCA? Write down the chat. What do you think was a pass rate? Right. So Arisa says 70. Sidra says 68, 65, 65, 70. Okay, so you're right. So the actual pass rate has varied between 65 and 76. But in the last sitting in May, the pass rate has gone down to 60, I believe it was 66.9. So essentially, one in the three GP trainees are not passing the exam, and two out of three GP trainees are passing the exam. Another question for you. What do you think is a pass rate among IMGs? All right, so 4951, that's the most popular answers I've got. So the actual pass rate for IMGs, based on the college report, was approximately 51%. In other words, 1 in 2 IMGs are not passing the exam. And this is where I've noticed that there are some myth around the SCA. And one other myth is it's an unfair exam, it's too subjective. Especially for IMGs, they feel that this exam is not fair. If you've sat the exam before, you might feel like that. And I want to share a story with you. So meet Dr. Gordon, a GP trainee who failed his exam by half a mark. And Gordon sat the RCA and then the SCA. He actually already had 3 sittings already. But the thing is, he was not an IMG. He was a UK graduate. Yet he was still going through this SCA where he couldn't pass exam. And he was really close by half a mark. Yet it was so far away. So imagine doing all the work and preparing, but then failing it by half a mark. It was really hard. So he could have said, yeah, this exam is unfair and it's subjective, but how would that change his situation? You know, you can't change it. Yes, there is a human being who's going to judge you, and there might be an element of subjective um, in the judgment. There is something that you can't actually say because if you've got two examiners discuss a case, both of them might have different opinions. But that's something you can't control. But what Gordon did was he acknowledged his feeling and he reframed the self doubt and negative thoughts he had and used it as fuel so that he could improve himself because that's something that he could control. You know, you can't control the outcome, whether you pass or fail, but you can control how you prepare. You can control how you respond to it. So that no matter what cases he could get and no matter who the examiner was, he was going to pass his exam. So Dr. Gordon achieved 87 in his fourth attempt, and he couldn't believe it when he got it. Now he's working as a GP in Manchester. So the second myth is practice makes perfect. Who here has heard that practice makes perfect? Just keep practicing more, or maybe your supervisor is telling you you're fine, just keep practicing. In my training, I received this type of feedback. And to be honest, it didn't do anything to help me. But the thing is, practice doesn't make perfect. That's not the entire truth. Practice makes permanent. And I've seen so many GP trainees going this downward spiral, just keep practicing and practicing, but they are not making any progress. And this is what happened to Dr. Inamuna Barraga, Dr. Chisholm, and Dr. Donald. All of them sat the exam multiple times, and it wasn't because they were not practicing, it wasn't because they were not working hard. They were all working hard and practicing. But the problem is when you're practicing and you don't know what you're working on, you might be reinforcing bad habits and you're just making it more permanent, and that's not going to help you. What you have to do is to realize that more practice is not the solution if you've already been practicing. And the cost of being stuck in training for another year or for 2 years, especially for Dr. Donald Onoha and other trainees who've got so many extension, it actually took a toll mentally, emotional toll. There's also a loss of earning while your peers are qualifying as GPs and picking up the jobs, you're still stuck. It also hit his confidence and the delay in career progression because your CCT gets extended. So imagine if you had to delay your training and your extension of your CCT date. That means that if you have this goal of becoming a partner, you're just going to delay it and you could be losing an earning potential of 80 grand every year that you're stuck in training. And that's quite a big amount. And this is something that some trainees don't realize, that there is more loss being stuck in training. And also sometimes there is visa implication, you have to apply another visa. So another myth I've seen going through this preparation with many GP trainees now is that sometimes trainees think that they can figure it out on their own. And then sometimes if they miss it by a few marks, they feel like, okay, I'll just work a bit harder and try again. But the problem is, it might not be in a year time, or maybe you'll need to take 2 years or multiple attempts to get there. And why do you have to reinvent the wheel when you could get clarity and know exactly what to do differently? If you're not seeing things through the right lens, you're going to see things blurry and it's going to cloud your judgment. And I've seen a lot of trainees being blindfolded, sitting the exam, going through the same cycle. And oftentimes in study group, this is common where it's almost like the blind leading the blind. Trainees are colluding with each other and they are not making any progress. Sometimes they're just practicing reinforcing um, poor behaviors in their SCA consultation. So Dr. Chisholm, in her previous attempt, she got 72.5. And I had a conversation with her. She told me that if only I knew what I did was not working, I could have changed it and I got a few more marks to pass. But the problem was nobody told her that she was not eliciting eyes in context and she didn't know that she had to readdress eyes. Imagine going through exam 4 times and nobody actually sat down and told her what to do. But eventually, when she learned that, she actually changed her practice with the feedback and the clarity that she got. And that made a big difference in her preparation. She went from 72.5 to 81 in her final sitting. So, as you can see, the transformation is life changing. She was stuck in training since 2020, and at least now she doesn't have to worry about the SCA. So you have to approach this exam, take it very seriously. You don't want to wing it, and you really need to understand what you're being tested on. So you're being tested on how do you keep your patients safe? How adaptable are you in treating different types of patients and illnesses? And how do you manage risk? Are you comfortable managing complexity or uncertainty? Uncertainty is a big one. And oftentimes, trainees are fine when they know the case, but when they are not sure, that's when they actually don't know what to do and they lose the ability to perform well. Also, how do you actually show up with your patients, the behaviors, the attitudes, and the concern that you show for your patient? These are all things that examiners are assessing. So let's talk about the marking. So your mark on 3 different domains: data gathering and diagnosis, clinical management and medical complexity, and relating to others. And the weighing of the domains are not equal. Clinical management and medical complexity is marked heavily, so 1.5 times the other 2 domains. So you have to make sure that you prioritize clinical management because that's where you will get more marks. Oftentimes, I've seen consultation where it runs up until 8 minutes in data gathering. And imagine if you got only 4 minutes to do your clinical management, you're not going to do a good management plan and it's difficult to score well in that case. So you have to prioritize. So how do you get clear passes? The difference between pass and clear pass is quite nuanced. Sometimes trainees don't understand. They feel like I've done everything I should, but still I didn't get any clear passes. To get clear passes, you have to go above the standard. If you're just doing what you're supposed to be doing, that's not enough to get clear passes. Fail is when it's actually under the standard and you didn't show enough evidence that you're safe to practice. And clear fail is where it's dangerous. So let's talk about the pitfalls. So what's the reason do you think trainees fail the SC exam? Share it in the chat. Share what do you think are the reasons. So some of you may have already sat the exam. What do you think were the reasons you didn't pass your exam? Okay, Sidra says communication skills. Yeah, communication plays a big part in this exam. If you can't communicate well under pressure, you're not going to show your skills, your attitudes, and it's going to be an issue. Time management, yeah, that's a big one. Anxiety, yeah, sometimes trainees they can't perform under stress and everything goes pear-shaped. Okay, so management, communication skills, yeah. So yeah, these are common reasons why trainees struggle with this exam. The first one is sitting the exam too early. If you're not timing your exam on the window where you're going to be ready, you're going to set yourself for failure. Sometimes I've seen trainees trying to sit the SCA and the AKT in the same month. It is quite difficult. It's not that you can't do it. Maybe you can do it, but you're not optimizing for a pass in both exams if you're trying to do both at the same time, or you're making it harder for yourself. So you have to time it well and make sure that you've got enough experience before you sit the exam. So when are you planning to sit the exam? Who's sitting it in September or later? Okay, Sidra is sitting in October, right? Anybody sitting in October? Anybody else? Okay, some I can see someone sitting in October, November, and then September as well. Okay. Yeah, so inadequate preparation. So if you're not already preparing right now, if you're sitting in September, you're already reducing your chance of passing the exam because this is a really difficult exam. You have to put in the work and preparation. You can't just wing it. Another one is poor time management. So if you're not actually using your clock or checking how long you're getting for data gathering and timing yourself is going to be an issue for the exam. You will find that you don't realize how fast the time goes by. Being doctor centered, sometimes I've seen it among hospital doctors who've had many years of experience in hospital. Then when they do the SC exam, they struggle. Lack of confidence is a big one. Sometimes people suffer with anxiety and they can't perform on the day. Overconfidence is another one. Sometimes I've seen trainees getting false reassurance. And even last week, I was speaking with a trainee whose trainer is an examiner, and she was told that you're doing well, you're going to pass. But she did not pass her exam, and now she's a little bit worried about the feedbacks that she's getting because the feedback is not really honest. And then sometimes I've seen this where sometimes trainers they know you, so they give you the feedback. They don't want to share feedback that may make you feel upset. They want to protect you. And you have to realize that if you're not getting objective, constructive feedback, that could be hurting you. Another big one is repeating the same mistakes over and over. So there are some unknown, and if you don't identify this blind spot, you're going to make the same mistake and you don't even realize it. And that is a big cause for failure. So if you're actually sitting your exam first time, or if you're sitting it after multiple attempts, it's very important that you learn from mistakes. Don't just learn from your own mistakes, but learn from others' mistakes so that you don't have to make the same mistakes. So let's take a look at some common mistakes in data gathering and diagnosis. The first one, like I've seen that so many times globally, when a consultation is not organized. So it is very unsystematic where the trainee is trying to do a bit of data gathering and then they found out the patient smokes and try and give a bit of advice on smoking and then go back in the history. It's disorganized. You don't want to mix data gathering with clinical management. Another one is not eliciting um, other differentials and just narrowing it down too soon. Let's say you've got a patient who's presenting with low mood. And if you think it's depression and you're not actually asking questions to find out whether there's psychosis or signs of other problem, then you're not going to show that you're making a safe assessment. And the differentials, you're going to miss it. Another one is in clinical management is when you're prescribing a medication, maybe you're not explaining the side effects to the patient, you don't tell the patient how to take it, or you're prescribing a medication that's not appropriate. For example, if a patient has got CKD, maybe you should be prescribing a nephrotoxic drug. Or if, let's say, the patient tells you they have an allergic reaction with this antibiotic, then maybe you don't know what's in second line, for example, or the alternative. And that's going to cost you marks in the exam. Another problem is not really thinking about the management of risk. So let's say you've got a patient who is taking apixaban and now they presented with hematuria. So you need to be thinking about the risk of bleeding, risk of clot, as a reason they're on apixaban, and making the right judgment call with the patient. If you don't show how you're coming to that discussion and conclusion, you're not going to score well in management. And the last one here in time management. So if you don't allocate yourself enough time in the clinical management, then you're not going to finish within 12 minutes. And that's a bit unfortunate because if you don't plan your consultation, then you're going to just run out of time. And then that would be not showing evidence that you need to fit in the safety netting and the follow-up if appropriate. So is this making sense so far? Let me know in the chat if you're finding it useful so far. Thank you, Ong. Thank you, Kingsley. Great. So let's continue. So relating to others is one of the domains that many trainees struggle, especially IMGs. And sometimes you might be doing things that might be perceived as a good thing, maybe in your country, but when you come to the UK, it's seen differently here. It's just a different culture and the nuances here in the communication that you might not have picked up. So a big one is not listening carefully and not picking cues. If you're missing these cues, then it's going to be an issue because you might miss an important cue and you overlook that cue and you think you're managing a case well, but then the patient's still worried about something else and you have never addressed it. And no wonder you don't do well in that case. Another one is not showing ownership or responsibility. This is where sometimes trainees think that shared decision making is all about giving options to patient, and oftentimes they're giving options, but they're not taking ownership of the responsibility. So the patient is coming to you for your professional judgment. You don't just give them option. You have to discuss what's the best recommendation as a doctor and explain to them what you're thinking and help them to make an informed decision. You're not supposed just to advise them, list the options. That's not good practice. So let's talk about the causes of poor time management. First one is insufficient preparation. Another one is if you don't keep track of time. Sometimes people speak very slow pace or have long pauses. See, when you speak slowly, your time is ticking. And if somebody is speaking faster, they get more done within that time. Lack of structure is a big one. If you don't structure your consultation, you might be wasting a lot of time going back and forth. Talking too much instead of listening. Some people, they have a tendency to talk a lot and sometimes they go around in circle and that's a waste of time. Asking unnecessary or irrelevant questions, that's very common. And then summarizing too much or over explanation. Sometimes trainees think that they're impressing the examiners, but actually they're losing marks because they're losing their patience. You don't need to explain and over explain or lecture your patient. You need to keep it simple. So how do you actually address these issues so that you can consult in 12 minutes? You have to prime your case very well. So there will be information you're given. Make sure that you read all the information and get to the bottom of the page, because sometimes I've seen people, they read it, but they miss part of it. Prime your case and anticipate what's coming up. Keep track of your time. Structure your consultation and organize your thoughts beforehand. That way your consultation is going to run more smoothly. Ask pertinent questions. Don't ask questions that you should not be asking. Sometimes, if they've already told you this patient smokes 10 cigarettes a day, and you ask a patient, do you smoke? It's not a good question to ask. Pace your consultation. Listen more than you talk in data gathering, and then give yourself enough time in clinical management, at least 6 minutes if possible. Keep your summary short and keep your explanation concise. So I love this quote from Benjamin Franklin: by failing to prepare, you're preparing to fail. So you see, like, a lot of the work is done in preparation. For many trainees who are not preparing well, then they're already down in a trajectory. And if you don't course correct, it's going to be very difficult on the day of the exam. You're going to feel anxious about the exam yourself because you know you haven't prepared well. So now I want to show you what are the top scorers doing. And this is Dr. Erwin Kwun, who scored 100.5 in his exam. And a lot of top scorers, they approach the exam with a different mindset. And they have a different preparation where they don't leave it to chance. They plan and prepare early. They develop self-awareness. So if you don't have self-awareness, then you might not even realize you're not competent at doing something. But when you have self-awareness, you're aware that this is something I need to work on. I'm working on this, or I've now actually addressed this issue in my consultation with timing. Now I can move on to the next thing. They also have a growth mindset. So if, for example, they are not there yet, they don't get discouraged, and they think they can do better tomorrow by improving today. So having that mindset where you improve by 1% every day is going to compound over time. Also, they understand what they're being assessed on. They actively seek feedback, and they're not afraid of getting the honest feedback, and they're reflecting on their learning. Also, they embed good consultation practice and develop their own style. Sometimes if you try and copy somebody else, it might not work for you, but maybe you're training consult in a different way and you're being taught to consult that way. It's not just natural, but it's also a bit odd for you to do that. So you have to find your own way of consulting that works naturally for you. Because if you don't do that, on the day of the exam, you're going to revert back to your old way of doing things. So it's much better to do it your own way, but to adapt it in a way that looks natural to you. So Archilochus tells us we don't rise to the level of expectation, we fall to the level of our training. And this is so important because there will be things happening before now and your exam. And for example, let's say if you have not prepared to high standard, then on the day of the exam, don't expect that you're just going to rise to that level of expectation. You're going to fall to the standard that you trained. And a GP trainee who was coaching actually told me a week before his exam, he had a really bad chest infection. And he wasn't sure what was going to happen. But because he was trained to a very high level, he managed to pass his exam. Even though he didn't do as best as he could, it was enough to clear it. So I'll talk to you about how you consult in terms of preparing and how to structure it. You know, the structure is a backbone of your consultation. If you don't have a good structure, it's like you don't have a roadmap, you don't know where you're going. But when you have that structure, you're going to know exactly what you should be doing at 2 minutes, 4 minutes, 6 minutes, so that you're not going to have to rush. So the first thing is get the patient's story out in the beginning. You know, the golden minute, ask open question and try and see what's the story about. A common mistake is trying to ask closed question about the biomedical too soon. Then you have to work much harder to get the history. So once you get the patient story, then elicit the patient's ideas, concern, expectation in context. Don't ask it like you're going down a checklist, but ask it in context. And for example, if you ask a patient, so what are you worried about? They tell you, I'm worried about a brain tumor, doctor. So you don't just ask, so what are you hoping? Because then it sounds a little bit like you're formulaic. So you should be acknowledging it. So for example, you could say, I hear you. It sounds like you've been worried about brain tumor. What was the reason you were worried about that? Then the patient might tell you, yeah, well, my cousin was recently diagnosed with a brain tumor. So now you get a bit of more context. And if you ask a follow-up question on the cue, then you will show that you're taking a history in a conversational way. And then you can say, let's see how I can help you today. So what are you hoping from today? See that way there's a better transition. So once you get the eyes, then you will know that the patient is worried about brain tumor. Then you can plan the red flags that you're going to ask to rule out space occupying lesion. And then you can target your history so you don't waste time. And once you've done that, you can ask psychosocial situation occupation that's relevant. So once you got these three buckets, then it's time for you to readdress the patient's ideas, concern, expectation. So you might say to a patient, I know you thought you could have a brain tumor and you're worried as your cousin was diagnosed, but having assessed you today, I don't think that's the case. What I think you've got is migraine. Have you heard of migraine before? So I'm readdressing and explaining what I think, and then I explain to the patient my reasoning. So the reason I think it's migraine is because you've got this headache on one side, and also it seems to be coming up with some blurry vision, which is typical of migraine. So then you can go and readdress expectation as well. So I know you're hoping for a scan today. The thing is, with migraine, we don't normally need to arrange any scan. And in fact, if you arrange a scan, it could expose you to unnecessary radiation, which could put you at risk of other problems. So then I explain that as well. See, so now the patient and I are on the same page. Then we go into the decision making about what we can do to help this patient's headache. So you discuss about the treatment, safety netting, and follow up if needed. So is this clear so far? Yep. All right. Thank you, Mushimi. Okay, let's continue. So now I want to show you how you can use AI to level up your preparation. So who here has been using AI? Who uses ChatGPT, Grok, or Gemini? Anybody who uses AI right now? So PSO is psychosocial situation and occupation. So Kingsley say yes, right? Anybody else? If you're not using AI, you're going to be left behind. You know, the world is changing, and AI on its own, you don't have to be afraid of it because AI is a tool that you can use. But if you've got a human and AI together, then that's where you're getting a different level of performance. So how do you use AI in your preparation? This is the essay companion that I'm going to give you access to this. So there is AI prompts that's plug and play that you can use in it. So what you do is you just copy this AI prompt. So let's say you want to get more analysis of your consultation in terms of how are you taking your history? Is it focus? So you take that, you copy it, and then you upload the transcript of your recording. So if you're doing a role play with a colleague, with a consent, record the role play. And then if you do it on Teams or on Zoom, you will get the transcription. You just upload it on ChatGPT, for example, with a prompt. And ChatGPT is going to analyze your consultation and will give you the feedback. So it will tell you based on, for example, the relevance of your questions, the clarity, and even give you a summary of your ratings and turn that information into actionable insight. So this is how you can use it, especially if you're doing some role plays in your study group and you want to get a different perspective. Now, ChatGPT can make mistakes, so you just have to be careful about what you're getting because it might not be 100% accurate, but at least you get a different perspective. Does that make sense so far?
Yes, it does.
Right.
But I was also wondering if you could explain a bit more about you mentioned some prompt and then asking for feedback. If you just could show us
So
possibly,
yeah,
or
so do you see the prompt here? So what you do, you copy that prompt
okay,
and then you paste it in when you use ChatGPT, you paste it. So the
okay.
way you
Where do
do
I
that,
get these prompts from?
so it's in the SCA companion. So I will share the link with you now, so you
Oh,
can actually
okay,
get
sure.
access to that.
Oh, perfect.
Okay.
Okay, thank you.
And if you're doing a role play with a colleague, you get the consent to do that. So you can do that. But I would not recommend using any patient information on the chat GPT because that's not um, something that you're allowed to do. So I've just shared it in the chat. Can you see it?
Yes, thank
Yeah.
you.
So you can just copy the whole transcription and paste it with the prompt, and the chat GPT is going to process it. It's really good at analyzing data. So you just feed it with data and it will come back with the output. Okay, so you see how I've done it? I've just copied it and pasted it here with the transcription of the consultation. Okay, so then it gives you the summary and the actionable tips as well. Okay, so this is Dr. Sunita Beffi. She passed her exam with a score of 87.5 in her first attempt, and she found the most useful part of the program was to use the SCA companion, which I've shared with you the link you can access. Because what happened was that she was able to keep track of her preparation, the consultation that she was doing, and also she was able to see what are the patterns of behavior that she was working on. She was then more intentional in her revision. So many times I've seen trainees, they just do cases here and there. But the thing is, our mind is designed to forget things. So 90% of what cases that you're doing, you're going to forget it in a month or two. So if you keep track of your learning and capture your learning on SCA Companion, which is a free tool that you can use, then you can come back to it and it's going to save you a lot of time and make you more productive. So, question for you. What was the most helpful idea you've learned today? Let me know in the chat what was the most helpful idea you've learned today. Okay, so Sidra says AI prompts. Didn't know that. Yes, AI as well. Anything else? Okay, so Sidra says a phrase. Sorry, Zainab says a phrase I've heard you. And so there's AI, use AI in your practice. Yeah. So yeah, so the AI is something that you can use for free. And with these prompts, give it a go and see how you can actually level up your preparation. Yeah, incorporating ice is so important. Okay, so now if I have your permission, I'd like to share with you the blueprint that has helped Dr. Inamuna, Dr. Chisholm, and many other trainees who've managed to pass the exam. Let me know if you'd like to see the blueprint that we've developed. Right. Thank you, Mushumi. Thank you, Ayodeji. Great. So I'm going to show you what we've done to help IMGs. But before I do that, I want to show you the stats. So just a reminder that 1 in 2 IMGs are failing the exam. It's like flipping a coin. And then the thing is, if you don't prepare, the playing field is not level for IMGs. The problem is IMGs are coming up in the UK where they're having to learn about the culture. Maybe in the med school days, they did not receive that communication skill training, whereas a UK graduate already got that and they understand the NHS at a deeper level because they've experienced it. So you have to realize that you're coming and you have to catch up. So if you do that work, you can then pass on your first attempt. And many trainees, they're going through this exam, they don't know what they're doing. They're going around and wasting a lot of time and sometimes resetting it time and time again. Whereas if you follow the blueprint, just follow a proven system, you don't have to waste more time, energy, and your resources. So in this blueprint, we have different phases, and we have managed to get 8 out of 10 trainees to pass the SCA exam. And the vast majority of trainees who join this program are IMGs. So this program is designed to help you pass your exam, finish training, and earn more as a GP. I've heard it sometimes trainees say to me, it's hard to find somebody serious to practice with. Everyone's too busy or not focused yet. Or sometimes in the groups, people are not motivated because their exams are a month away. And then you're practicing with strangers and you're not making good progress. So when you join our program, you're going to join our community and we're going to show you exactly how to um, revise and use your time productively. So you're going to set the foundation. We're going to help you to consolidate your preparation so that you stay on track and how to polish everything before your exam so that on the day of the exam, you're ready. So there are 3 core pillars that we focus on. The first one is a mindset. And this is Dr. Randika, who passed his exam first attempt with a score of 99. And he's an IMG, but despite being an IMG, despite he had a lot of difficulties in his own practice, I think a month before his exam, he did not even know which practice he was going to sit his exam because there was a lot of struggle with the supervisor in his practice. So, but despite all this, he managed to pass his exam. He overcame these doubts that he had. And he says everyone has a potential to pass this exam, but you have to go in with a winning mindset and your environment matters. The second one is strategy. So if you're not using the right strategies, then you're doing things the old ways and you're not going to get the results you want. You have to use proven strategy and instead of working harder, work smarter. And the last one is feedback on your consultation and identifying these blind spots that you don't know that you're doing. Sometimes trainees, when they're speaking, they're doing things with their hands, they're touching the face, or they're doing things like all these cues that you're giving are going to affect how you're perceived by the patient, and they're going to lose trust in you. And these are things that you might not even be aware of. Another one is when you're speaking, when you're doing a video call, let's say you're looking at the patient, you're looking down. Whereas if you're looking at the camera, see, now you're bridging the virtual gap. So you can see me looking at you. Whereas if I look down or I'm writing down, these are small things that you might not even aware that you're doing. So that's where the feedback is so important. And getting that regular feedback to help you refine your consultation. So Confucius tells us, I hear and I forget. I see and I remember. I do and I understand. So this exam is an exam where you have to practice and get feedback and improve. You can't just learn it by reading guidelines or reading books. You have to get in and practice. So it's a bit like if you're swimming, you have to get in the water. Otherwise, you can't really learn swimming if you stay dry. And then so many times I've seen people so focused on the skill, but they forget that they're being assessed on the attitude and the behavior as well. And this is why we have got this immersive workshop. So I'm running one on the 16th of July. It's a Wednesday morning, and we go over 12 high-yield scenarios. These are role plays with train role players. So please mute yourself. Okay. And we go over these difficult cases. So for example, ethical dilemma, third party consultation, if it involve safeguarding. So these are cases where it's very likely that you're going to be tested on. And you're going to learn from the feedback from the role players, from myself, and you will know exactly where you stand so that you understand not only what are the problems in your consultation, but how to fix it and how to score clear passes. So I'm running one next month, and there's already some people who actually book it. If you're interested, it's from 8:45 to 1:45, and then just send me a message on the chat, and I'll send you more detail. And in this program that we've got, you also get a course that you can learn at your own pace. So I go over in much more detail. Today we've only got an hour, so I'm just touching the surface, but there's much more where you learn the strategies, how to maximize your score, how to time your consultation and use proven method, and also how to manage risk and certainty. So when you join the program, you just put in your email address and your password, and you will get access to the learning modules. And as you can see, it's organized into modules and lessons so that you don't get lost. And you'll get over 32 case demonstrations that you will see and learn from. And we cover all the 12 clinical experience groups in it. So if you have not been successful in your SC exam, and maybe you're looking for that one-to-one support to work with me, you get everything we discuss in the VIP package, plus you'll get a strategic planning and personalized action plan with myself. We will make a plan based on the mistakes that you've done in the previous attempts, and you learn from constructive feedback, ongoing support. If at any time you're not sure about something, I'll be here guiding you. And there will be 5 one-to-one coaching sessions with myself. And in each session, we go over 3 different high-yield scenarios. So you'll get clarity and feedback on everything that you're doing. And at the end, a clear action plan. So you get everything for just less than a shift of locum for only £600 today, and 2 additional monthly payment of £600. So I've only got limited spaces for this offer because I'm already coaching trainees. If you would like to join this, then please let me know in the chat and I'll send you the link. There's only 3 spots available. If you're still stuck in your training and you don't know what else to do, I'll be more than happy to see whether I can help you. And if I can help you, then we'll get you enrolled and we'll start working towards your exam. So then we actually can hop on a Zoom call and chat and see what have you been doing in your preparation, what are the things that we can work together on. So this is Dr. Gordon, which possibly you remember, who scored 87, and he joined the one-to-one coaching program, and now he's actually able to work as a GP. And we actually met after he finished his exam and celebrated his success. This is Dr. Vijay, who went from 65.5 to 86. See the jump in 20.5 marks. And this was a turning point for Vijay because he failed the AKT multiple times and he sat the SCA fail it. At that time, he thought he would never pass an exam. But because he passed the SCA exam, he was then given um, an extension and was able to attempt the AKT afterwards. So we've got over 85 testimonials, and this is Dr. Moeed Malik, who joined the workshop, and he passed his exam first attempt. So we've got many more testimonials. So as you can see, the trainees who've gone through this program, they had experienced the one-to-one approach, and they made an impact and found the breakthrough they needed to unlock their career. So if you want the help that you need, you're tired of trying the same old way, you want to do something different, I'll write down the link so that you can book a call and then we can see if you'll be a good fit for the one-to-one. And we can see if I can help you. So now I want to finish on these 3 key insights. Okay, so most of you here have been preparing and you've done a lot of hard work coming to this country if you're an IMGs, going through different exams. But sometimes you go through these challenges, you have setbacks, but believe in yourself. You know, you can do it. Many GB trainees have walked this path. And as you can see from the report, 1 in 2 IMGs have struggled. So if you are currently struggling right now, don't lose hope. Don't isolate yourself. Learn from your mistakes and seek expert guidance. Even if it's not from me, make sure you're getting good guidance because there's a lot of information out there. Sometimes this information can be conflicting, but you need to get guidance that's applicable to your situation. Okay, so I hope you found this useful and I wish you all the best in your preparation. And if you've got any question, I'd like to open the floors for questions.